Hi everyone. I want to extend a big thank you to everyone who joined our 4th live event where we discussed the reinvention of healthcare delivery in light of the COVID-19 pandemic. The pandemic has fundamentally changed the world as we know it, and we're all living differently, working differently, and in many ways thinking differently. At the event, I was joined by Dr. Luke James, James Sherwood and Sarah Snyder, the Principal of Health and Life Sciences from global consultancy Oliver Wyman. We discussed what these changes mean for our sector specifically and how customer needs, attitudes and expectations are changing in relation to digital healthcare. As ever, the topic drew some fantastic questions from our intermediary partners who joined us, and unfortunately we were unable to answer all questions on the day. To ensure that we do give a response to any outstanding questions, I've invited the guys back to provide you with the answers. So without any further ado, let's start. We all know that the pandemic is having and will continue to have a huge impact on some of our customers. And during this difficult time, we've tried to do everything that we can possibly do to support them, both from a health and wellbeing perspective and also in terms of financial support. In addition to rolling out new and improved remote services to all of our customers and providing regular quality health and wellbeing content online, we've also committed to pass back any exceptional financial benefit to our customers arising as a result of the pandemic. Also, as a public health emergency, COVID-19 has been treated through the public health system. As there's no private healthcare option available to our customers if they need to receive treatment for COVID-19, they are able to claim a cash benefit instead.
The pace of innovation in healthcare is increasing all the time. Right now we're seeing developments in drugs, new personalised medicines, robotic procedures, prosthetics, the role of use of AI in diagnosis, and increasingly virtual and remote healthcare services for customers. Some of these developments lead to new treatment possibilities for individuals that extend life and improve outcomes for individuals. We've seen this particularly in cancer, where the developments of the past 5-10 years have been remarkable. Customers are have access to treatment to cure cancers that were untreatable 5 years ago. This is great for the individual. It does, from a healthcare cost perspective, it does increase overall healthcare costs because we are treating things that we couldn't treat before. Some other developments are come with only marginal gains in terms of outcome, and those we need to question whether they are a useful or valuable addition to the range of services that customers have access to. Virtual healthcare is very interesting. It has the opportunity to change the way that care is organised and delivered, both improving access to healthcare, but also improving or tackling waste in the way that the current care system operates. So we see both potential benefits from new remote services in improving affordability of care, but also risks. Now, the key question and issue for us at Bupa is how we work with providers to deploy these capabilities in a way that kind of maximises benefits and value for customers over the medium term.
So I think this is a really good question, and I suppose we've highlighted the opportunity here around remote surgery using robotics and 5G, and some of this has taken place, but it's limited at the moment. And clearly, the things that are mentioned here around anaesthetics and immediate post-operative care and nursing and vital signs, etc., are clearly going to need human to human interaction for many decades to come. However, what I would say is that the potential around this is that you can have a highly specialised individual surgeon who is likely to be very limited resource, able to carry out operations remotely, and clearly your other allied health professionals and anaesthetists and staff to make sure that operation goes smoothly are likely to be in much greater supply than the expert surgeon. But clearly this is something that's in development and we'll see, I imagine, rapidly develop over the next 5 to 10 years. But quite rightly, we're decades away from completely autonomous remote surgery. So I think the advances we've seen in digital have been very fast paced during the COVID crisis, as we've needed to pivot and shift to deliver these. I think because the period of the COVID crisis is ongoing, and we're now several months down the line, these are likely to be embedded just naturally as the healthcare system moves forward. So I don't think we will see the level of development perhaps as speedily as we saw during the crisis, but I absolutely think that a lot of this will be embedded and taken forward. And certainly the conversations I have with colleagues in the primary care setting and in the secondary care setting in the UK indicate that they're already shifting their models of care and their operational delivery of care to embrace some of these technologies. So this is a really interesting and valid concern. What I would say is that we've got many, many years now of experience of virtual primary care consulting. So we have guidelines around remote consulting. We have lots of experience of safeguarding training. Interestingly, all GPs in the UK have to go under safeguarding training, and that's recently been expanded to even more hours of safeguarding training. And clearly there's a focus on those doctors who are working virtually to be able to deliver a high level of care and be aware of safeguarding issues and how to escalate them. So I think there's a definite risk there that safeguarding cases could go undetected. But I believe it's all about the training and the clinical governance around virtual consulting that will ensure that this doesn't happen. And as I say, virtual consulting in primary care has been around for a long time, so we've got a lot of learning that we can take from that into the secondary care space.